All right, time for another episode of The Bayview, where you hear everything from my perspective, which is, of course, naturally the right perspective. No, just kidding. But anyway, today I wanted to talk about a nipple versus areolar reduction. A lot of people get confused on what a nipple versus an areola is. So, just to kind of not to offend anybody and not to make anybody feel silly, but I just want to go over the very specifics of the two different anatomical areas of the nipple versus the areola, so people are really on the same page. So first off, the areola is the pigmented round area on the breast, and in the center of that, of course, is the nipple. People often think of the whole area as the nipple, and I just want to clarify that because that can be confusing when you're talking about different procedures. The whole area, the areola with the nipple in the middle, that can be referred to as the nipple areolar complex, NAC for short. But when you're specifically talking about one or the other, it's really critical to be very specific about that, because a lot of times patients will come in and say, I want to get a breast augmentation, I want to put the implant through the nipple. Well, nobody's actually ever put an implant through the nipple itself right in the center. What they have done is the doctor has made an incision along the edge of the areola, and they put the implant in through there. So that's why it's critical the patient understands you're not putting an implant through the nipple where they think that there would be no obvious scar, but you are putting it along the edge of the areola, which actually the scar actually fades really well and looks really good. So just want to make sure we're all on the same page on that. Now, when it comes to a nipple reduction versus an areola reduction, a lot of people didn't even know you could do a nipple reduction. But in some examples, if you see that the nipple is very long, the patient can request to get the nipple reduced. And the way we do that is we take a wedge of the nipple, and then we remove that wedge, and that shortens the nipple, shortens the height of it. We put some absorbable stitches on the top, and that can help close that area, reduces the nipple. The patient may have trouble breastfeeding afterwards, but usually the point people are coming in asking for a nipple reduction is after they're done having kids, after they're done breastfeeding. And why does the nipple get so long? Well, probably because they had kids and they were breastfeeding. That's also the reason the areola often expands and gets really wide, is after pregnancy. And you can do an areola reduction. And just to be clear, you can do a nipple reduction without an areola reduction, or you can do an areola reduction without a nipple reduction. You can do either separately or together. But when you do an areola reduction, you're just removing skin around the areola, making an incision around that, and that's usually done in combination with a breast lift. So what we do is we remove excess skin, including around the areola, and we tighten up the breast skin envelope. And by tightening up that skin envelope, you're lifting the breast, and it makes the areola smaller in the process. So if you are getting a breast lift, like I'm talking about, where you go around the areola, it will always shrink the areola. You can't really do a breast lift like that without shrinking the areola. So that's kind of the overview of nipple reduction versus areola reduction. Hopefully that was very helpful, and you enjoyed this episode of The Bayview. Let us know and comment below if you have any questions.